Hi, I'm Sandra Barrington, Executive Director of Sierra Nevada Memorial Hospital Foundation, and welcome to Doc Talks. This is a series where we bring in local physicians so you can learn more about our local community physicians, how they got to be where they are in their careers, and maybe a little bit about their services and what they see as the future of healthcare in our community. And today I'm very excited to have with us Dr. Glenn Gookin, who specializes in family practice medicine and is board certified, and has a lovely family in this community. His wife is also a physician, and we're so lucky that they chose this community to practice in. And so welcome to Doc Talks.
Thanks so much for having me, Sandra.
Yeah. So tell us a little bit about what it took to get you to this point in your career, what education you had to go through, and maybe why you chose family practice.
Absolutely. So I am from Southern California. I grew up in the mountains outside of LA in a community kind of similar to this. There was some historic gold country where I grew up too. And so I think I always had a jonesing to come back to a rural area and to live in a smaller community because that's where I grew up. After I finished high school, I went down to the city in Southern California. I went to the University of California, Irvine for my undergraduate degree. I studied biological sciences there and was trying to figure out what I wanted to do with my future when I went into graduate school and did some air pollution health effects research.
Oh, interesting.
So yeah, growing up in Southern California, you think of LA and smog and all of that sort of things. And I was actually a child participant in a children's air pollution health effects study.
Oh, wow.
Put on by the University of Southern California. And so after finishing my undergraduate degree and trying to figure out what I wanted to do, I found a lab that was working with them through the University of California, Irvine as well. And it was fun. It was a lot of field work and doing a lot of ambient air pollution monitoring and testing for different toxicology related things.
Wow, that's
so
fascinating.
I liked that program and entered into it as a graduate student. And the project that I proposed, my advisor told me didn't really fit within the guises of a master's thesis, so I switched to the doctoral training route, joined the program, and started my PhD work. And during that time, I was focused on the cardiopulmonary effects of particularly biodiesel-based fuels. And so looking at how trucks and then moving towards green-based fuel technologies would lead to health effects. During that time, I really enjoyed the bench work and working in the lab, working with some rodent-based models and then also working with some different epidemiology studies with humans. And I realized, though, that just working in the lab and writing grants wore on me a little bit, and I missed working with people. So during that time, I had a very supportive advisor and team there that let me participate with some of the medical students at UC Irvine as well. And so during that time, I started a student-run free clinic along with some medical students there. And a lot of the people, one of my biggest mentors that I met along the way there was a family physician. So she, I think, kind of planted the seed in my mind of leaning towards family medicine. During that time, I met my wife. She was a graduate student in the lab, started as a technician, and then became a grad student in our lab. And we both went to medical school. I had after finishing my PhD work, I was at that point 11 years in at Irvine. And so that was a long time. I was looking for a fresh, kind of a change of pace, and had a great opportunity to go to medical school at the University of Central Florida in Orlando.
Wow.
They had a new training program, and my sister-in-law was teaching at their business school. So I went and just loved the program, loved the curriculum, the new facilities, and had a great 4 years of training there. And during my time at UCF, we started a student-run free clinic there as well called the Knights Clinic, which stood for Keeping Neighbors in Good Health Through Service. And we partnered with an amazing nonprofit called the Debo Fund in Central Florida and worked a lot with basically underinsured or uninsured patients to get them access to healthcare. And so during that time, I think that's when I really kind of fully solidified for me that I wanted to work with underserved patient populations. And I was back and forth between emergency medicine and family medicine. I think some of that comes from things that I like doing outdoors and the lifestyle of emergency medicine, but I really
missed the adrenaline of it.
The rush. But I missed working with patients and having a relationship with them. And that was the draw to me for family practice, was getting to have a life cycle, working through an entire family unit and getting to see them, take them through disease courses, take them through the highs and lows of life. And so that's kind of what ended up making me choose family practice in the end.
That's really interesting. So you took quite a different path than a lot of physicians take, going PhD first. and then MD. So I imagine when you were in your training program for MD, you were probably a little more mature than some of the people in your postgraduate education.
Some of my bosses would say no, but yeah. But I think I did get to come in. Anytime you enter a job with just a few more years under your belt in the workforce, I think you bring a little bit more life experience than some others have. So I did feel lucky in that regard. But if my kids followed my path, I would recommend them not doing a combined route just because it's a little easier. But it worked for me.
Yeah, great. Well, that's really fascinating. And so locally, where do you practice locally? What clinic or office? And tell us more about the services that you do.
Yeah, so I did my training down in South Sacramento at Methodist Hospital, which is part of the Dignity Health Network up here that Sierra Nevada is a part of. And as I was entering my second year, I was trying to figure out where we wanted to stay. My wife was in the training program with me, and we opted to stay in Northern California because we liked the scope of practice for family physicians up here. Tends to be a lot more broad, that we can do a lot of what we're trained to do. And we looked at the 50 corridor and the 80 corridor, and we just really enjoyed Nevada City and Grass Valley and this whole region. And so we looked around, and my wife took a job at Chappaday Indian Health Clinic here in town. We have practices in Grass Valley and Auburn. And so she worked as a full-time practitioner there. I had dreams about a training program that I was starting, and so opted to start as a hospitalist physician at Sierra Nevada for my first 2 years, before switching over to now doing a hybrid role where I practice at Chappaday as a primary care provider and also work in the hospital.
Okay, so a lot of people maybe don't know what a hospitalist is. That's a term we throw around a lot, but that's a specialized form of medicine for physicians who specifically practice in the hospital. So that's really great that you've provided that service. Now let's talk a little bit about the residency program. You mentioned the training program and wanting to start that program. So tell us a little bit about the residency program that we're starting here.
Yeah, so graduate medical education to me is a real highlight in an area that I am passionate about. It's how we train medical students into the specialty that they're going to practice in. So for family medicine, the big draw for me is taking care of infants all the way until people at the end of life. And for us, we decided a way to address a big workforce shortage. It's estimated right now in the United States that by 2030, there's going to be up to 52,000, a shortage of 52,000 physicians, primary care physicians. And so for me, a logical way to address that is to help train more docs. And there's a lot of evidence that shows that if you train in the place that you're going to live, you're more likely to stay there.
Exactly.
So our thought is we build the docs that we want to stay and live here to address some of that workforce shortage. So when I came up here, I saw that this community is ripe for graduate medical education. We have a really high quality hospital that can provide all of the learning that we need and some great outpatient practices. Chappaday was the one that we've identified with to be the community clinic where residents are going to do their training with patients in the outpatient setting and then go into the hospital for their inpatient setting.
Yeah, this is such a wonderful program for our community. Dr. Gookin and I have actually been working on this program for a little bit. He's been the champion and the catalyst and the ambassador and the residency program director. And it's been many years in the making, but we have a match day coming up, don't we?
We sure do. So it's a fun thing that for anyone who's watched medical shows about the interns and things like that, we find out on March 17th who are going to be our first 2 resident physicians. So family practice, medical students that have matched to come and do their training with us in our community. And so March 17th is a big day for us when we'll find out who those first 2 are that'll be joining us in July.
That's great. Yeah, so they'll start in July, and a great collaboration with Chappaday and Methodist Hospital of Sacramento. It's taken many years to get all the entities together and everyone on the same page, and you reached national accreditation for your program in the fall.
We did last October, and so we are very excited to offer our first class. They'll be doing maintenance of accreditation coming up, and we'll have them full-time in our community in July of 2024 because they'll spend most of their intern year down at Sacramento at the Methodist Hospital.
And by 2025, we'll have 6 physicians training in our community.
We sure will.
So that's wonderful. And a lot of aspirations to grow the program as well.
Absolutely. And with the hoping that they will want to stay and work here and set their family up and practices in town with us.
Well, thank you for being a catalyst for that and for helping to solve a real community problem with primary care physicians. So you'll be the residency director for that program. How are you going to balance your patient time and your admin time to manage the program?
I've been coaching a lot of my patients as I go through now that that a lot of my patients will have their care co-managed with the residents.
Oh, wonderful.
And coaching with them about how that's only going to improve their care, not make it worse. You're going to have a fresh graduate out of medical school, state-of-the-art training, and then getting to have also me in the background teaching, overseeing, and kind of shepherding them along with their training, along with lots of my other colleagues that are going to make up the faculty of it.
That's great. So really engaging the whole medical community locally.
Absolutely, which is a huge passion that we're trying to improve, of getting our hospitalist physicians who are covering the load of what we used to do as general practitioners, seeing all of our patients in the hospital, which we're so thankful for that service they provide, but getting them to talk to the outpatient doctors and the doctors to talk back to the inpatient doctors a little bit better, so that there's just a real continuity of care for our patients when someone is sick enough to need care at Sierra Nevada.
Well, we're all so excited for this program. Thank you for championing it. And thank you for joining us for this edition of Doc Talks. You can find us at supportsierranevada.org and on Nevada County Media. Thank you for joining us.
Absolutely. Thank you, Sandra.